President Trump is making good on his State of the Union address promise, and his reform of the 340B drug program is helping Americans with HIV save on prescription drugs at rural and small community hospitals. One America's Neil W. McCabe spoke to an expert and has more from Washington.
President Donald Trump has promised to take action on drug prices, and one of the ways his administration can do that is reforming the 340B program and opening up transparency in drug prices. Liz Mair is a Republican strategist who works on health care issues.
The 340B program is a way by which poorer and less well-off Americans are able to get access to discounted drugs, and it also serves as a mechanism for keeping hospitals and healthcare providers open in rural areas that tend to serve poorer and lower-income patients, including a lot of Trump voters.
The main part of the 340B program is the rule that forces drug companies to sell drugs at a steep discount to these community and rural medical facilities. Those facilities are then allowed to bill the insurance companies at the full retail price, thus creating a privately funded subsidy for bringing health services to poor and rural areas.
There has been a move to try to gut the program, and one of the things that's been really gratifying to see out of the Trump administration is that in fact they have moved forward with ceiling price regulation, which is important for establishing the ceiling price at which drugs in the program can be sold. Also transparency tools that will allow people to ensure that they're not being overcharged.
Mair said it is consistent with Trump's call in the State of the Union to make prescription drugs more affordable.
The next major priority for me and for all of us should be to lower the cost of health care and prescription drugs.
The president also touted programs to help those fighting HIV in the speech.
The president obviously made a major focus in his State of the Union address on combating HIV, which is somewhat associated with the opioid crisis. And one of the ways that HIV-positive individuals are able to get drugs at a discount and treat HIV is through the 340B program.
The Center for Disease Control reported that although the majority of HIV cases are in urban areas, of new cases, 23% live in non-urban areas in the South, and 21% live in non-urban areas in the Midwest.
President Trump's support for the 340B program, it's not just good policy, it's actually great politics.
Big Pharma is fighting the president's 340B protections, and on Capitol Hill, Big Pharma's fight is being led by California Democratic Congressman Scott Peters. But he is joined by Republicans like Indiana Congressman Larry Buckshon, making support for higher prices on drugs bipartisan. Neil W. McCabe, One American News, Washington.
Want to see more videos like this? Click on the link below and subscribe to One American News on YouTube. And call your cable provider and kindly demand that One American News is added to your lineup. Call and subscribe today.